Yeah, I think most importantly, like everybody lead by example, especially in the healthcare field. That's one issue I have with that, or many obviously issues with the healthcare system. But one in particular is that we're not leading by example. If we were a healthcare system, if our goal is to create health, which I don't think that is what the healthcare system was designed to do. It was designed to manage disease, or at least that's what it currently does. But if that is the case, then we should all be leading by example. We should all be being well. The patients that are coming in sick need to see what health looks like,
Right.
you know, and also there needs to be a mentality shift within the space.
Greetings, and welcome to When the Moment Chooses You. I am your host, Coach Charlene, and I am delighted today to have Kwame Terra with me. Did I pronounce that right? I want to
Yep.
make sure.
Kwame.
Okay,
Yeah.
cool. Kwame. Okay, Kwame. Well, it's really great to hear from you. So I'm extremely excited to unpack who you are. So why don't you start off with telling us who you are first?
Yeah, so my name is Kwame Terra. I'm the CEO and founder of Bear Health. We're a startup company based in New Orleans, committed to maximizing health in the Black community. I was born in New Orleans, Louisiana. I grew up in Houston, Texas, though, so that's why you don't hear the accent. Ended up coming back here for undergrad, and ultimately went to graduate school here at Xavier University, Louisiana. I guess you could say that's where my focus on health and public health and Black health, were shaped. And yeah, just been on a journey. Decided to go after the world record for the most steps in 30 days recently, all related to raising awareness for the work that we're doing. Walking had become a big part of the culture at Bear Health. Several users have completed 1 million steps in 30 days, and
Wow.
each of them have lost 20 plus pounds, come down or off medications. And it's sort of become an original challenge of ours. In fact, two
Yeah.
users just completed 1 million steps last month in 30 days. One of
Wow.
them was a 64-year-old woman here in New Orleans. And yeah, it's just really inspiring to see people of their own accord taking on these kinds of challenges. There's no incentive in that challenge in particular. And yeah, just transforming their health and
Wow.
transforming themselves.
Yeah, that's really awesome. We're going to unpack a lot of that. So, I started this podcast really because of all of the different things that were happening in 2020 with the murder of George Floyd and the other brothers and sisters that passed on. And I'm a nurse, and I was a nurse leader at the time, probably one of the very few. So when that happened, I mean, I just it really irritated me to the point where I could no longer stay silent. And so I actually found my voice. And so I went into prayer because I'm a woman of prayer. And I heard these words: what you do in this moment will determine your destiny and dictate your future. So I knew I had to break my silence and began to start speaking up with some of the things that I was witnessing and experiencing as a Black person. And so that's kind of what came out of it. I found my voice, and then I began to start using my voice to raise awareness and, all the things. And I work in maternal child. So that's an affected area, obviously. And so that's kind of why I wanted to start capturing people's stories. And so I started this in 2022, and it's been really amazing just to hear all of the beautiful stories of the trailblazers. So that is like profound. So your why behind what was your why? I want to know your why behind it. Was
Yeah,
there a
so
personal conviction why you had to do it?
yeah, it was actually similar to you, motivated during the COVID-19 pandemic, the George Floyd movement. It just communicated to me something that we all already knew, is that though our country is equipped, just wasn't designed to, and ultimately doesn't seem like it will, make it a priority to elevate and help Black people reach their full potential. And so, again, instead of going in and trying to change the system and make it better from within, which, feels like working against the grain, I
Yeah.
decided that we start and build a brand new one from the ground up with the Black community centered from the beginning, so that we can develop the best solution to our problems, whether they're health problems or other social problems that we have. The ultimate mission is to help each Black individual reach their full potential in life, because if we are all that we can be, then we can support each other to the best of our abilities and ultimately rise together in whatever forms that we can envision. So yeah, actually, I received a text message from my aunt, who also went to Xavier. She's a physician's assistant, and she was working, in the hospitals during the pandemic, or in the clinics during the pandemic. And so she was seeing everything firsthand. And so she shot me a text one day and said, "Hey, nephew, I think this would be a great time for you to kick off your healthy eating initiative again." Because I'm the plant-based, vegan in the family. And I'd done some screenings of documentaries throughout the city of Houston before, where we got about 100 people to come watch the documentary What the Health. I put together a panel and everything, and she was like, it would be great to see you kick that off again, but focusing mostly on the Black community, because obviously that's who I'm seeing the most in
Right.
clinic right now, and just so we can start getting ahead of some of these conditions that are putting us at risk for severe illness with COVID-19. So hypertension, type 2 diabetes, these comorbidities that again just make it harder for our bodies to defend itself when faced with a significant challenge like a pandemic. And
Yeah,
so,
absolutely. Just what you saying that, like, it really took me back because a little bit before the pandemic and then in the pandemic, I lost two sisters. One before the pandemic, 55, post pandemic, I mean, right in the pandemic, 44. And all of it
so
was heart
sorry.
attack. Yeah, it was heart attack, but it really was like a lot of the things that we eat. I mean, just being honest about it. I went into the military when I was 18, so I kind of like got drawn into a different world. And so I ate a little bit differently, but still I got issues. So I would love to be plant based, but you have to help us out with that one. But I think what you're doing is so important for our community. So tell me a little bit about how did you come up with just the thought, like, "Okay, I wanna break the world record?" I mean, that's just like a thought.
Yeah, it wasn't just a thought. It developed over time for sure.
Okay.
I actually want to finish the thought process of coming up with the idea for Bear Health, if I may. So,
Yes.
and again, also, I'm so sorry for your losses, and that is ultimately the problem that we're trying to solve at Bear Health. My first thought after I received that message from my aunt was that we don't know how bad we're doing as it relates to our health in the Black community.
Yes.
We know we're not doing our best. Like, we all know that. We know we should be eating better. We know we should be exercising more. But I don't think that the connection is strong enough to where we can sustain motivation to prioritize our health. Like, I don't think we know that, my mom, her good friend, lost her husband to a stroke at 46. I don't think that many of us know, especially in my generation, that if we don't get it together, we can have a significant event like that, and it cut our life short, and the impact that that has on our families and our friends and anyone who cares about us. And it's just, right now there's a 6-year life expectancy gap between Black people and the rest of the population. Average life expectancy in the Black community is 72. Average life expectancy, rest of the population, 78. And 6 years might not sound like a lot when you think, 72 years, but when you extrapolate that across the entire Black population, that's 268 million years of time lost, untapped potential wealth. And time compounds, obviously. Time in certain things compound. And so it's not just 268 million years of time, it's 268 million plus the missed out compounding effect. And we have to recapture that time in the Black community. So that's why we started this. But I don't know what the trends are showing right now. I haven't looked at the latest data, but I'm assuming that life expectancy is going down in the Black
Yeah.
community. Well, I wouldn't be surprised if it entered the 60s within the next decade if we maintain the current trajectory.
Yeah, absolutely. I just noticed, even I live out in California, so I noticed that they're building more dialysis centers and things like that. So, I mean, for me, I'm like, you know what? This is crazy. They're already preparing because they know that people are not going to take care of themselves. So I think
So
was very,
they know they're not gonna change the system.
yeah, the system is going to be the system. And so I love your approach with coming from the outside, doing us doing the work, us making sure that we're being healthy. Because when that happened with my sisters, prior to that, a few years before that, my mom, she passed at 61. My dad passed at 55, all young. So, as I was getting up, well, when all of that happened with my sister, that was it for me. I was like, you know what? That's it. I am not going to die like that. I'm going to do what I'm supposed to do, eating right, exercising, and doing all the things, lack of stress, because the big
Mhm,
one that I saw was stress in their lives. They had so much stress and what they were dealing with finances and, all of that
mhm.
stuff. And so I just kinda make it a pact, like, "Nope, that's not gonna be my portion," but it has not been easy.
Mhm.
It has not. So I really like the ideal of your app. So tell me a little bit more about your app because that sounds amazing.
Yeah. So my goal again was to communicate clearly to the Black community our current health status because again, I don't think we are aware of it.
Mhm.
And we do that through a health score. So health score is kind of like a credit score, but for your health. It'll be a
Okay.
number between 0 and 1,000 that represents your overall health. And it'll be based on your lifestyle. So your physical activity, your diet, and your sleeping habits, also your medical and mental health, right? So there's a mental well-being section on the app. There's a physical or medical health section on the app where you can log your blood pressure, cholesterol, glucose, heart rate, things like that. And all of these data points go into your health score. And that score will change day to day, week to week, depending on how you change, right? So if you go
Mm,
on a run or a walk one day, your score is going to go up a few points. But if you're inactive for a week or two, you'll start to see it say trending down. That was that was part of the problem that I was trying to solve because when I was doing events previously, we'd have these one-off experiences that can be transformative for people. I know people who attended that event that I put on in Houston in 2017 who have been eating plant-based since. Again, that works, but most people are going to be inspired for a moment after an event like that,
yeah.
and then I'm not in a position to follow up with them when they slip back into their old habits as we naturally do because, we get back into our old environments and then the stresses of life, the convenience of the unhealthy food. And again, I get it. And so I wanted a way to be able to follow up with people in a systematic, organized way. And that's really what the app is designed to do. So, okay, you came to one of our meetups, whether that was a plant-based eating workshop or a run club meetup, and now you're excited about your health, you're going to get on a journey. And so you're moving and eating better for a week or two. And then, you know, naturally again, you just kind of fall back into your old ways. Now I can send you a nudge. Say, hey, you're trending in the wrong direction right now. Just
Mm,
check in to see what's going on, make sure everything's okay. How can we re-engage? And so we start off with the app, and then ultimately we expand to product, services, infrastructure based on and informed by the data trends that we see in the community. So all of the user data goes into what we call the Black Electronic Health Records, which is a
okay.
real-time database of our user health insights that we use to inform and drive community health solutions. And so each month we're looking at the average health score overall across the user base, the average health score by gender, average health score by age, average score in each category. So what's the overall activity score of the community? It's 618, so that's pretty good. We're doing great in that category. We're going to continue to do the things that we've been doing to get it to where it's like 618, but in the physical health or the mental health category, it's 500. So let's go see what work we can do, what strategy we can come up with. How can we go engage people to help them improve their mental health or their physical health so that we can ultimately elevate that average score. But since we've been doing that, since we've been tracking the collective health score report, we've gone up by about a point per month. So we started tracking in December of last year, and we went from an average of 543, which is in the fair range, so still elevated risk of chronic conditions, things like that,
Yes.
and now we're at 543, which is closer to the good range, still in the fair range. But being able to see that on a monthly basis, the trends going up after we deploy some sort of intervention or messaging or challenge within the app, yeah, it's that was a vision, and we're working it.
So, I mean, how many people are we talking about? Are we talking about all over the world?
Yeah,
Like how many
primarily
people?
in New Orleans. So our company is based in New Orleans, and a lot of our approach is community based.
Okay.
But it'll be a slow build, but it'll be built the right way, and hopefully that culture scales as we scale, right, and it's sustained as we grow. But we have about 2,500 users on the platform currently, so 25 members in our community since we launched last year. Again, that's the community that we're looking at, these collective trends. And the majority of them are in New Orleans, probably about 75, 80%. There are people in Atlanta, people in LA, people in Houston, depending on different pop-ups that we've done throughout the country. But the majority of our work has been done here in New Orleans, majority of the promotion, so on and so forth.
Wow. And then what about age range? Are you getting all types of
Yeah.
generations in there?
All ages, we'll do activations here on campus at Xavier University, Louisiana. So we'll get a bunch of college students. We'll do activations at run clubs, which always has a diverse demographic spread, from 18 to 70. I've met people at run clubs I would say that the most engaged users are middle-aged Black women, in again, particularly around steps. Something about steps just it just is get y'all.
Hey, that's our power walks.
Yeah, no, but I love it. You know, again, it is Black women that have driven this walking culture on Bear Health that is transforming people's lives, and so yeah, and also it's an urgent problem
Yeah,
for not just middle-aged Black women, but middle-aged individuals in general. And it's an urgent problem that also are willing to spend some money on and work to try to solve it. Ultimately, our goal is for everyone to be on the app. This isn't an app that we want people to use just because they want some personalized health coaching. We want
right.
everybody to be on the Black electronic health record so that we can understand the baseline where the Black community is as it relates to our health, so that we can then take the learnings from one city and bring them to another. Let's say the average health score in New Orleans, which is 543. Let's say in New York, it's 575. Okay, well, let's go see what's going on in New York to see what we can do or see what we can take from New York and apply it to New Orleans, right? So this is a
Yeah,
very collective effort to improve health in the Black community. And I want to know that we did it. Like, I don't want to
right.
just feel like we're doing better, right? So that's really what the value of the data is. And again, whether you're engaging with the app to improve your health or you're just there to be a part of the solution.
Yeah. Well, I like the approach that you're taking because, we know about all of the disparities that are going on in our world. And so to be proactive and, navigating that is like pretty powerful, actually. So I'm wondering, is there any options like for younger kids? Because you know how they're so impressionable and they're that age range. Have you gotten to them so that they can just start right in a sense?
Yeah, we haven't yet, but that's certainly part of the plan. Ultimately, the company will expand based on where people who come into our community want to take it. There,
Yeah.
there are individuals who I've met at different conferences who were like, we need to get this in the schools. I'm like, great, let's do it. Lead it.
Yeah.
Because again,
Ex
still a still early stage founder and working with very limited resources, and so my focus can only be in so many places. But I'm absolutely open to working with folks who see a potential for this in different capacities. Getting it to the kids. Anybody can download the app, right? That there's an age limit related to the algorithm for the health score. So the
Okay.
health score is based on health data, which typically you're not getting health data on surveys and stuff like that from people under 18. And so
Right.
we can't say that it's reflective of that per se. However, it's still, you know, a valuable insight if someone if a kid is 13 and is on the app, but they have to basically the algorithm is going to only be delivering them a score based on it if they were 18, which is okay. I think it's still to your point, like getting them thinking about these things a bit earlier. The main challenge is going to be funding their space
Yes.
on the app, which I'm sure there's tons of money out there to fund work like that. But if we could design it in a way where essentially those who can pay it forward, right, for young people to be on the app, right? So in 2 months
Yeah.
when we pivot to our official app, because right now we're on our beta app, and part of why we haven't really launched nationwide because we just wanted to make sure that everything looks right here. Once we do that, the app is going to cost $5 per month or $50 per year, and it's not actually a subscription to the app; it's a membership to Bear Health, which includes
Okay.
the app and events that we host. And we also are opening up a space here in New Orleans called Bear Connect, which will be a co-working space by day and wellness by night. So you can come study, you can come work if you work remote, or hang out, whatever it is that you want to do during the day, and then in the evening, we'll host run club meetups, walk club meetups, yoga sessions, so on and so forth. And that membership will be $5 per month or $50 per year. Maybe you go to $10 per month, $100 per year.
Yeah.
But like finding a way to, again, we need to do this ourselves.
Yes.
But a collective effort among the whole community to make sure that we're good as it relates to our health, because everyone else or every other part of the system seems like it's dead set on the opposite.
Yeah,
And that's
absolutely.
that's okay. We have to be okay with that and take responsibility.
Yeah, yeah, that's absolutely awesome. So, one other question about the app. Are there interventions in there, practices to help the people like with stress management, for instance?
Yeah. So we don't offer any services at this point. through Bear Health.
Okay.
Our goal is to help people become aware of their current health status and then connect them with
Okay.
care and services, right? So again, we partner with run clubs, we partner with yoga
Okay.
instructors, we partner with these folks and say, hey, really, like what the product is becoming is join our community, know your status, and then find a community that you can be
Okay.
a part of. Because when it comes to accountability in particular, like if we could, like most of us need other people to stay motivated, and no wonder, people right now are doing something that they hate just to be around other people. Running, most people hate running,
Yeah.
not enjoy that at all, but so many people are doing it right now just to be around other people. And it's because
Yeah.
we're so isolated, because of technology. And it's a really beautiful thing to see that there's still that deep need, right, that we haven't
Yeah.
just kind of let go of that, and I love that. So that's really what we do. It's like download our app and come find your community. Whether it's
Okay.
whether it's a challenge in the app, right, an online steps challenge because you're not ready to, actually be around other people as you're working on your fitness journey, but or if it's a meetup here, or if it's a brunch meetup, or because everything, different strokes for different folks. Not everybody wants to run, not everybody wants to do yoga, but that's kind of
Right.
the message of Bear Connect. So we have Bear Health, and our brand promise is that we're your health partner for life. And then Bear
Mm.
Connect is where you find your community.
That's like super awesome. I'm so excited about your community. So I'm gonna have to download the app. So you're gonna have to tell us how to do this in just a moment. But
Yeah.
I have to go back to your 2 million steps, is it? Plus, how did you get the grit, the determination, the mindset to like literally walk? And because I think I read that it took you like 10 hours a day
It
to
actually
walk.
ended up being way more because I miscalculated a variety of things, and I was at least on my feet 14 hours a day walking.
Like how do you do that? Your mindset.
So I've been in this startup space for about 2.5 years now, and there are just some things that I've learned along the way that have just created a perspective and a mentality for me where I just walk, headfirst into anything, and I don't actually care about the outcome, like whether I accomplish it or not.
Okay.
Like I'm not pressing myself about whether or not I accomplish it. If I got halfway through the challenge and just couldn't do it, that would be it, and that's okay. Do you know what I'm saying?
Yeah,
I
that's
think that
awesome.
that gets in the way of a lot of people pursuing things because they're like, well, what if I fail? And
Yes.
that's fair. That's a fair concern, but it actually just doesn't matter. You're a little further along than you were when you started, and that's a good thing. So that's why I was just willing to try it. Why I decided, or like how the idea developed, was again going back to users on the app doing 1 million steps in 30 days. So in May of 2024, Dr. Eric Griggs did 1 million steps in 30 days and got taken off his blood pressure medication. Right? Super powerful story. And he was just raving about it, really, literally across the world. And then the next month, he passed me the baton. And so I did 1 million steps in 30 days. And just to break it down for people, that's 33,000 steps a day, about 5 hours of walking per day, 15 total miles. And Dr. Gracie, he's not like a super professional athlete or anything like that, just a regular everyday guy, just like anyone else. I did it in June. Another user did it in July. He did it in 28 days and lost like 28 pounds, right? And then two more users did it last August. Another one did it in October. And it just kind of became this thing. And we all got to talking, hey, what do you guys think the world record is? And do you think any of us can go after it? And so that was last fall. And, basically, I was like, in March, I was like, hey, I think I'm gonna go for it in April.
I mean, is this something that you like build up? Like I'm trying to
I think
imagine
I
like
think it's something that you should build up to. I don't think that I did. So I'm a runner, and so I was training for
okay,
10K. So I did have my legs under me a bit before I decided to go after it. But
okay.
hypothetically, it would be something, or ideally, you would train for this and prepare for this in some way, like maybe do 1 million steps a month consistently for a few months before going after 2 million, or it's essentially gradually improve or increase your demand to where it's not a shock when you first go after it. But I did not do that. However, I do have a significant endurance background. I ran cross country and track at Xavier.
Okay.
All of my family members are runners. Four of the seven kids were collegiate runners. So again, there are some advantages I had there, but at the end of the day, that it was just hard every day. I was doing
Yeah.
67,000 steps a day, 14 hours a day on my feet, burning like 2,500 to 3,000 calories, 30 to 35 miles of walking per day. Yeah, each day was hard. Each day ended around 11 p.m.
So I was gonna ask you that. When do you start something like that? Like early in the morning?
Yeah, so I would start at 6 o'clock. I would walk for 4 or so hours, get like 20,000 steps in, go home, shower, go to the office, make sure everything is good. Then I would go to the fitness center here at Xavier, walk around there for 4 hours, and that was a brutal experience. But yeah, just walk around there a great deal, and then go back to the office. And then by the evening time, I would go outside, go walk to a friend's house, walk to a festival, walk everywhere, walk to a meeting. I was literally walking all day, every day for 30 days, and the first 5 days were really challenging. Just obviously, your body's adjusting to the demand,
Right.
and new parts of my body were being strained because, again, running and walking are different movements, and with running you get a lot more rotation in your legs, and so things are just a bit looser in a good way. And but with walking, your legs are pretty straight every time you land, and so my knees were so stiff early first 5 days as my body was adjusting. Also, I wasn't fueling properly. Again, I didn't really plan this
Right.
well. So, um, again, I didn't have, and I also fast every day. So I eat one meal, and then I snack on, nuts and seeds and berries throughout the day. And so now I'm having to shift my eating schedule, and it's hard because I'm not necessarily hungry, because
Right.
your hunger is driven by your eating schedule. You get hungry when you normally eat, not necessarily
Yeah.
when you need food. And so now I'm having to, like, essentially force myself to eat. Even now, as soon as I started eating, I could eat forever. Right, because again, I'm burning all this good, but I just getting to the process of eating and making sure I was getting all my steps in. So yeah, I started getting sharp pains in my head because, again, wasn't hydrating or eating enough, and then people started bringing me food and making sure that, you
Oh,
know,
that's good.
yeah, 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 yeah. So and on those days,
So you had a lot of support in the
I would
community
say, yeah,
as you
yeah,
were doing it.
for sure. People walked with me. People, supported me online. And people fed me. It really would not have been able to accomplish it without that, because especially early on when I first announced it, people were probably just like, what's going on? What, world record for the most steps in 30 days? Like, I mean, I get that you walk a lot, but what's this all about?
Right.
And also, we had just lost some funding due to a very minor discrepancy. Basically, our company was founded 3 months prior to this arbitrary cutoff that the funding folks had for us, or for their program. But we were expecting it. Like, 5 months had gone by since we kind of took care of the paperwork and everything, and then they just flagged this like right around the time it was time to distribute the funds.
Oh,
And yeah, so that took it that we took a hit because we're still a early stage pre-revenue company that's more or less dependent on external funding to keep the lights on. And so, part of why I took on this challenge was to challenge myself in a challenging time, because naturally we would just, it's easy to just kind of stay at home and wallop in your sorrows. And I just kept moving, you
yeah.
know, because yeah, results
Yeah.
follow any.
Yeah, this is such inspiring stories. The people that usually watch my podcast are nurses,
Okay.
doctors, like consultants, coaches, and things like that.
Yeah.
So how can we be a support to the work that you're doing?
Yeah. I think most importantly, like, everybody lead by example, especially in the healthcare field. That's one issue I have with that, or many obviously issues with the healthcare system. But one in particular is that we're not leading by example. If we were a healthcare system, if our goal is to create health, which I don't think that is what the healthcare system was designed to do. It was designed to manage disease, or at least that's what it currently does. But if that is the case, then we should all be leading by example. We should all be being well. The patients that are coming in sick need to see what health looks like, and also there needs to be a mentality shift within the space. And again, I understand all of the conditions and challenges that might come with shifting the perspective and the focus of the healthcare system to creating health as opposed to managing disease. But it's a crisis. And again, I'm not one to just kind of accept things the way they are. And I understand that not everyone is like that, but I don't think we really have anything to lose in shifting that, and taking those chances and having those ambitions. So that'd be the first thing: lead by example. download our app, find out your health score, and start walking for your health, whatever or whatever it is that you like to do. Because people need to see that you guys are to them, they're looking to you for health. You're bringing them health. You're the conduit of health, and they need to see what that looks like. That's one thing that I would say. One thing that I was talking to another nurse about here in the city recently was that health isn't strong enough of a motivator for people, right? And so this isn't something that would be having an impact on the direct patients. This would be an impact to the broader community. Health isn't a strong enough motivator to get people to move, right? We need to be, a bit scared, right? Fear is a stronger motivator. And
Yeah.
I was sitting down with a nurse, and she was just telling me stories about just patients day in and day out. And I'm just like 37 with a stroke, 45 with like people need to hear these things.
Yeah.
I think if the general public actually heard these statistics, which are especially here in New Orleans coming through on a daily basis, I think it would motivate people to start thinking about their health a bit more because again, it's similar to like climate change. It's like it's something distant in the future. Like I'm
Right.
gonna worry about that then, and it's happening now. And I think we came up with this idea of the nurses report where it's like a nurse is just sitting there at the end of her day. She's in her scrubs and she's just very casually, not in a very, super organized way, just kind of on their phone. This is the report today. One patient came in with this, you know, condition. They're this age, and just kind of just let people know what's happening. And
Yeah.
then they start thinking about it. So
Well,
maybe
it's
you
so
guys come
true.
in the nurses.
I know that's true because, like, even like me as a nurse, I remember with my mom, she had diabetes, she had high blood pressure. So I would try really hard to educate and to tell her, mom, especially when I saw things getting like really, she had to get on dialysis and, yada, yada, yada. And then I was like, Mom, you have to stop drinking those Pepsis.
Hmm.
And she said, Listen, you are my daughter. I'm your mama. Don't tell me what I'm supposed to do. I said, Well, I'm talking to you as a nurse
Hmm.
and I want you to live. I was like really just trying to pour my heart out
Yeah.
like that. So I think my question to you is, are you seeing any resistance at all with your app or people that come to you are ready to do something to
Right.
change
Right.
their
Yeah. Yeah.
life?
So we target environments and communities where people are actively working on their health. Right? They're
Okay.
not necessarily healthy yet,
Right. But they're
but
at least
they're at a
trying.
run club, right? They're at a yoga meetup. They're in these places where they're open.
Okay. Got
Mm.
it.
So that's where we focus. However, I do think that there's a opportunities at points of care where people are seeing the end result of not doing what they need to do as it relates to their health. One additional comment I wanted to make as it relates to healthcare providers. I hear it all the time from people who, have hypertension, type 2 diabetes, things like that. Their providers, and I don't know exactly the motivation, and maybe you can help me understand it, really, really lean into the concept or the idea that the condition that you developed is not necessarily your fault because it runs in your family, right? And and I know that conditions like hypertension, type 2 diabetes, and cancer, we can be predisposed to these conditions.
Right.
But just because our parents had them or our siblings had does
Exactly.
not mean that you have to have these are 80%, 80-90% lifestyle conditions that
Exactly.
can be slowed, stopped, and reversed. And I think that needs to be the default message from jump with patients. It's like, hey, this condition is completely driven by this. Just because your family had it doesn't mean that you have to have it. And if you don't want to be on medication for the rest of your life, this is what you need to do. I'm going to treat this condition currently with medication so that we can manage it and it doesn't get out of hand. But this is the prescription. You have to change your life.
Yeah. You know what? I absolutely don't think that that's happening enough where I call it the darkness within the system because it's these tendencies to say that because my mom had this heart attack, you are at a higher risk to have it. But I'm not if I change.
It's not helpful.
Yeah, it's not because I mean, you have to take the reins yourself. So I took the reins myself because the system's going to tell you what the system says.
Mhm.
You know what I'm saying? It's everybody goes in this track. And it's not that no, I'm not accepting the tracks.
At least, yeah.
And so I know what you're saying because I don't know really why that is.
I think that people are literate, but not everyone is health literate, right? Those are 2 different things, and I think that when we hear something like, "Oh, it's hereditary," that means there's nothing I can do about it.
Exactly.
And to a provider, they
Exactly.
they know that it doesn't mean that there's nothing you can do about it. Providers know that you can do something about your predispositions, that they aren't basically a sentence, right? It's not a guaranteed thing. And people who are predisposed to all conditions can live long, healthy lives without ever developing the condition.
Well, you just pulled out something really important, just even in the discussion that you're having, because as a provider, as a practitioner, if you really care and lean into a person to see them and to hear them, then you should want to offer that in
Mhm.
addition. You know what I mean? You
Yeah.
should want to offer me saying, you know what, because sometimes love is, you have to contend with people. And
Yes, absolutely.
so that's what and that's kind of what I hear you saying, let me know that, you know what, if you keep on doing it like this, this is going to happen because that might say, I'm like, okay, maybe I
Yeah,
shouldn't do this.
people aren't spoken to like that. And in
Yeah.
fact, I think the motivation behind mentioning the hereditary nature of some of these conditions is to pacify and make people feel better about their circumstances. Because the doctors do want, like, they don't want people to feel bad. Like, I get that.
No.
Like, I
Right.
understand, and I respect and appreciate that motivation. But tough love is necessary. Like you're saying, it is an act of love to tell someone directly that this is why you have this condition and this is what you can do about it. It's what you must do about it.
Yeah.
And this is a human thing, and leans into, like, our, I guess, unity in a sense. It's like, you wouldn't, like, how would you talk to your mom about this situation? Or how would you talk to another family member? You have the authority and the responsibility to be candid with
Yeah.
people about their health.
Exactly. And then what I found too, Kwame, is a lot of us don't really ask the right questions. We just take whatever is said and just go with it, but without actually asking questions. Well, what do you mean by that? Or, I just don't tell me that, okay, here you have this and that's it. No, let me dig in a little bit. Let me ask you a few questions, but it's this patriarchal type of system where we don't ask the questions that we need. I mean, I've witnessed it. I went to the doctor with my daughter, and I mean, it was horrible. I mean, he didn't even like check her. She had back pain, and he just asked questions. He had no idea I was a nurse or anything, and I didn't say I was. I just watched because I wanted to see the interaction because she was telling me, "Man, I'm so tired of going to the doctor because they don't listen. They always say just need to lose weight, need to do ABC, but not really anything that she could really grab and say, maybe there is something wrong. Maybe I do have something, which, we found out later that she did have something going on, but just straight up like ignoring
Mhm.
symptoms and stuff like that and not actually touching to see, to palpate, to see if something's really wrong. It was so wild. I was like, oh my God, this is why she doesn't like the doctor
Yeah.
at all.
Yeah, doctors are
Yeah,
busy, so yeah, in doctors' defense and nurses' defense, like, to be able to ask all of these real questions, there's not
takes
really
time.
time,
Yeah,
you know?
because you only get like 15 minutes to do what you gotta do, and then I gotta go to the next person, so the system
Yeah,
is broken.
it's the system. Now, part of what our solution is able to do is ask people these questions about their lives. So we ask
That's
people, how many
awesome.
hours of sleep do they get per night? How do they feel about the quality of their sleep? And how many servings of fruits and vegetables are you eating per week? Again, and we're able to track this on a monthly basis. And I hear often from our community, like, when they're first engaging with us, they're like, "Oh, my doctor's never asked me this question
Yeah,
specifically about sleep," which is honestly the most important part of your health outside of community and purpose.
right, right.
People say they're never asked about their sleep.
So critical. Hey, that's how we reset.
That's how we heal.
Yeah, it is, so that's good. Well, I am so excited about the work that you're doing. Is there anything that, you would like to tell the audience before we close?
Yeah, a couple things.
Anything else?
First,
Okay,
download our beta app. It's called Dacadoo. That's DACADOO. And we can come up with an access code. What would you like the access code to be for your community?
Moment? Maybe you could just do the
Moment?
word
Yeah.
moment. Yeah.
So, yeah, we'll create access code moment, all caps or lowercase, all one word, and you'll need that access code to enter the app. Then you'll answer some questions about your height, weight, age, location, and then you'll get into the app. Your account will be created, and then you're going to want to complete your health score assessment. So it'll be about 14 questions. Answer as honestly as possible. No one's going to be judging you about your health score, but it's important that the data in our platform is reflective of the current health status of the Black community, so that we can be the most effective in developing solutions to these problems. And then make sure you connect a tracker. So we integrate with Fitbit, Garmin, Apple Health, Google Fit, Samsung Health, pretty much all of the trackers, so that your health score can update automatically. And then join a challenge, or if you're local, come to one of our community events so that you can be a part of it. When it comes to health and comes to helping people actually change, I've identified over the past year and a half three things that are, I would say, required. Maybe one, you can be without one of them, but three things that are, they need to be in place to for the optimal, to increase the chances of you actually transforming your health. So the first one is you need an objective. That could be a broad objective. I want to be healthier. I want to run more. Right? It can be a very broad objective, but you have to have that desire on some level. Right. Second is you need a time bound test of that health, let's say. So, or that objective. So for your general health, it could be, I want to have a normal blood pressure and a normal such and such by 3 months from now. Cool. Or I want to finish a 5K and this time 3 months from now. Or some sort of time bound test that you kind of are feeling the pressure to change and make sure that you hit that accomplishment. Or it could be, I want to cook plant based more. Right. And in 3 months, I'm going to cook a plant based meal for my family. Some type of time bound test of that objective. And then you need a community to do it with. You need other people who have similar objectives, maybe similar time bound goals to do it with. And the last one is the most important. If all you had was an objective and you found a community of people who were already doing that, it would just naturally happen. You would just essentially feed off of and grow off of what energy these people are already putting out. And so that's really our solution. Or I think one of the most effective solutions for health transformation is help people understand that they do need this objective, right? By revealing to them their current health status, for example, and then connect them with a group of people who are already on that type of time. And then
Yeah.
naturally you'll essentially borrow energy and borrow perspective and borrow attitude from these people who are already doing it. And next thing you know, you're a runner. Like, yeah, I've seen it happen so many times in our run club here. People hate running, but they're looking for a community. Their objective was to, you know, be around people more. Their objective was to run more. Literally, I ask people all the time, "Why did you start running?" I just wanted to run more. I wanted to be a runner. Okay, and then they came to a run club, and now they show up every single morning, every Sunday morning at 7 a.m. They run 5 miles, and they probably hadn't run 5 miles at once in their life before last year.
Right.
It's just,
That's awesome.
that's the solution, and we need the app so that we can track the impact.
Yes.
Because the solution, like, we need a system, we need infrastructure so that we can stay coordinated with all of this, so we can stay organized. Because without it, we're doing all this great work in different places, but we don't get to see the results, and we need to see results. That's what,
Yeah,
or at least
absolutely.
progress toward our objective in order to sustain motivation. Like, we're human beings, we have to feel like there's a point, you know.
No, yeah, you're right. You're right. That's awesome. Well, I want to thank you so much for being on the show. It was so insightful and inspirational. And if there's anyone out there with funding, that would be a great opportunity because this sounds like an amazing venture that you're on. And I'm so excited to meet you. And thank you for popping by our show to let us know. But definitely, I'll put all of your information down in the description so people can find out more about you. I'm definitely gonna download the app. So you guys, let's do this. Let's do
Good.
this. Let's work it.
Yeah, again, lead by example.
Yes.
Right, we need to create a community of people who are taking the initiative to transform their health, so that as other people come into the community, they just feel like this is how you gotta be. You see what I'm
Yeah,
saying? It's a
absolutely.
culture thing.
Yes. One more question before I go. Is there menus on there for plant-based?
Actually, there will be next week. So
Okay,
We got
cool.
some community feedback for that, and our health navigator actually just texted me and asked me about the plan for next week. And so our plan right now is to essentially create a breakfast, lunch, and dinner,
Okay,
or yeah, create breakfast, lunch, and dinner options for like 1 day a week. So you can do it whichever day you would like.
that's perfect.
And that way you can, pick if you're doing one meal a day, or if you want to do just one whole day where you're plant based, just kind of introducing people to it. So yeah, that's definitely one thing that we're gonna have. Yeah,
Okay.
make sure you follow us on Instagram at Bear Health. That's BEHR Health. And then also follow me on Instagram, Kwame Terra, KWAMETERA.
And we sure will. Well, thank you so much for being on this show.
Thank you for having me.
Hey, thank you so much for listening. Hey, I want to invite you to join my Substack community. I actually have a free newsletter that I send you every month when you join. There's also another level to it. If you're a paid subscriber, you actually get a copy of my book, When the Moment Chooses You, and signed by me, as well as the access to a Q&A segment that we do and other live shows that I'll be doing. I'm also going to be doing a special Awaken Align class for those who want to really pursue their destiny and seize those moments that are in their life. So join that community. I'm trying to move things over there so I can have more contact with people. So I'll see you over there. I'll put the link down to join. And basically, it's only like $10 a month and $8 a month if you do the yearly subscription. So I look forward to seeing you over in that community. Thank you. And I love and appreciate all of you. Bye bye.